Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Choosing a Medicare plan can be a challenging and time-consuming process, but with the annual enrollment period in full swing, now is a great time to look into whether you need to choose a different plan based on your healthcare needs. Today we'll talk about the different Medicare options, the help that's available to you, and what you should consider when choosing a plan. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back to Healthy Living for Life. Joining me is Kimmy Everman, a program officer with Montana's Office on Aging. Thanks for coming on our show to talk with us about Medicare this morning, Kimmy.
Sure.
So let's focus on the basics first, if that's okay.
Sure.
What's the eligibility criteria for Medicare?
It's really easy. You need to be an American citizen and you need to have 40 work credits, which is about 10 years of full-time work. If you don't have that 10 years, the folks at Medicare will work with you to try to figure out a way for you to get Medicare, but maybe at a slightly higher fee.
Okay, gotcha. So there are different parts of Medicare, right? Can you just give us an overview of those different parts?
Sure. 4 parts, actually. Part A, which is your catastrophic or going to the hospital insurance coverage. Part B is when you're going to the doctor just regularly for checkups and things. Part C are called Medicare health plans or Medicare Advantage plans, and they encompass all the parts of Medicare. And then Part D, which is our newest part of Medicare, is for coverage of RX medications.
Okay, perfect. Can you talk about some of the different eligibility periods for Medicare?
Sure. These get a little bit more confusing, which that's why I want to first say, go to your SHIP counselor. I hope we can put their numbers on the screen because this is so important. Your initial enrollment period is an IEP, and that is 3 months before your 65th birthday, the month of your birthday, and then 3 months after. So you have a total of 7 months to get signed up. As I am a worrywart, I say do it as soon as you can, unless you have other reasons not to. The AEP is the annual enrollment period, and that's coming up really quickly. It's October 15th through December 7th, which is, of course, Pearl Harbor Day, and that is a time when people can sign up for either a different Part D plan, or they can sign up for a different Medicare Advantage plan, change over from original Medicare, etc. Really good time. The general enrollment period is the GEP, and that runs from January through March. And so if the person has missed that annual enrollment or their initial, that's when they're going to come to get enrolled in Medicare. Unfortunately, that person may face a penalty, and what I think is maybe the bigger consequence is that if you sign up during the general enrollment period, your benefits do not begin until July 1st of that year. So you're still stuck paying your own way medically for 6 months. And then there's also something we love as SHIP counselors. It's called the SEP, which is a special enrollment period. And that, we call it the get out of jail free card, because it helps us help Medicare beneficiaries move around in the Medicare system if they've made a mistake somehow and they need to move.
Okay. So do folks just sign up for one part under Original Medicare, or how does that work?
Original Medicare is an 80-20 split, which means Medicare pays 80% and the beneficiary pays 20%. A lot of times that beneficiary will say, well, I want to make sure that I can pay that 20%. So they may go and get a completely separate, but it goes along with original Medicare insurance policy called a supplemental insurance or a Medigap. These help the person cover that 20% that they're going to owe out of pocket. But they're a whole nother piece that goes along with the original Medicare.
What's the difference between original Medicare and Medicare supplement?
Just that, again, the supplement is a completely different sort of product. It's an insurance policy that's sold by a private organization. And if you want to find out more about that, you just call up your SHIP counselor locally, or you can also call the Commissioner on Securities and Insurance, because they are the ones who are administrating these plans, or overseeing them, not administrating, overseeing them, and they have lots of good information as well.
Great. So folks can call to get more information, but can you just give us a general overview about some of the different supplement plans?
Sure. They range from A to, I think it's M or N now. They're named A, B, C. And they are standardized. So every A from any company you buy is going to have exactly the same menu. B, C, D, exactly all the same. The only thing that they can do is give you more benefits. They can't give you less. Right now, over my tenure in SHIP, the Plan Fs have been quite popular. They help pay the person's, if they have to go to the hospital, they might help pay that copay that you pay when you go into the hospital for the first time. They help pay for some of the services that you are going to get. Where original Medicare, that's just your coverage, and the coverage is 80-20, 80%, 20%.
Okay. So you already talked about some examples of when someone might go for a supplement. But when would somebody look into getting one of those plans?
Well, you have to remember as a beneficiary that there's going to be a fee or a premium. So if you have that kind of financial support where you can do that, that's when you're looking.
Okay, great. We're about out of time, but can you give us a quick breakdown about Medicare Advantage plans? Right.
Medicare Advantage plans involve every piece of Medicare, A, B, C, and D. It's for folks that don't really have they don't really want to see the same physician all the time. They can get in pretty quickly and get out. And they often have extra benefits, maybe a little bit of dental, maybe a little bit of vision or hearing. So you need to look into that when you're looking at a Medicare Advantage plan.
Okay, perfect. And they differ per county, is that right?
It does, because of the way that CMS has them set up. They're by county, so you have to look and see, and probably talk to the company that you're looking at to make sure that they cover your company or your county.
Okay, thanks, Kimmy, so much. We do need to pause for a quick break, but there is help available for choosing a plan or just understanding the basics behind Medicare-related health plans. We're going to get that information right after this. Stay tuned. Welcome back. We're still talking with Kimmy Everman, a program officer with Montana's Office on Aging. Thanks for sticking around with us, Kimmy.
Absolutely.
So before the break, you did talk a little bit about SHIP counselors. Can you talk, that's a state plan. What is SHIP?
You know, thank you so much for letting me talk about SHIP, because they are the most wonderful advocates that you could find. They're a statewide network of counselors who are extensively trained in Medicare, and the SHIP piece of it stands for State Health Insurance Assistance Program. There's one in every state in the territory, so we are a national program, and they are delivering no-cost, objective information to the beneficiary, or the beneficiary and their family, or just the family. Whoever needs that information can come to the table. And I'm just going to read the list because there's so many things they do. They do counseling on Medicare, of course, dual eligibility, which is Medicare and Medicaid, Medicare prescription drug plans, supplemental insurance, and the Medicare health plans that we talked about, which are the Medicare Advantage plans. They also are going to help that beneficiary identify any kind of support program that might be available to them, meaning there are some programs that can help people pay for their Medicare. And it is certainly a hand up, not a handout, and we really try to get folks on board if they look like they might be eligible to apply. And a good thing to remember is that we will see or work with anyone who has Medicare. So you don't have to be 60 in order to get it. You can come come and see a SHIP counselor as long as you have Medicare.
Okay, and SHIP counselors will even come to your house, is that right?
Yeah, that's true. There are always folks, especially some of the frailer ones that we work with, who cannot travel to a SHIP site. So sometimes if they need to, the counselor will go to their house and have a home meeting with them. So it's a very nice way for Montana to cover all those miles.
Really great. And you said no cost. Is there ever a time when there's a charge for SHIP services?
Nope, never a time. You know, certainly if a person wanted to give a donation, that's up to them, and we would, you know, we wouldn't say no because it's so helpful to our programs. But there's never going to be any kind of bill, or you know, you're not going to get something in the mail that says you owe $50. Nothing like that. And I'm glad you brought that up, Beth, because if someone on TV or on the internet is saying they'll do stuff like this for you for a cost, call a SHIP counselor first, because we will do it for you as part of the fact that you're a citizen of the state of Montana.
Perfect. And so if folks don't cover the cost for SHIP, where does that money come from? How is SHIP funded?
Well, SHIP is federally funded by the Administration on Community Living, and they are also where they administer the program. That's where I always say the marching orders come from. And SHIP came to be in 1992. Congress standardized those supplemental program or policies we were talking about earlier. And Congress decided that people needed people that could help them decipher all that information. And all these years later, we've really evolved into a great advocacy point and resource for beneficiaries and their families.
So great. And you mentioned too that there are folks on Medicare who might be able to get a little extra help, a hand up, not a hand out, as you said. Can you talk about that a little bit more?
Certainly. There's a couple of things. First of all, Medicare Savings Program. And that's a program that's going to help you pay for your Part B. And then there's also the low income subsidy, or LIS, you might see it as, and that helps pay for the Part D, so the drug coverage. Either one of those does have asset limits and some limits to income and that kind of thing, but you don't know till you try. So go to a SHIP counselor and ask to have some assistance applying for those programs if you haven't already. The worst they can do is say no, and that's not so bad always.
Right. So does SHIP also help Medicaid members or just Medicare?
Yeah, in a way. We have many, many folks, especially senior folks, who are Medicare, Medicaid eligible, which makes them dual eligible. And as long as that Medicare piece is in the mix, yes, the SHIP is going to work with that person, and more and more, although they are not the Medicaid experts, they certainly know how to fill out the applications and who to call if there's a problem.
You've mentioned dual eligibility a couple of times now. Can you talk about when somebody might benefit from that?
Yeah, you know, we have a lot of folks in Montana and all over the nation, seniors who are making very, very, very low wages every month or benefit every month, and they cannot make it all go far enough. And so we feel like helping them find these programs we always say, you know, if you get the MSP, for instance, the Medicare Savings Program, that's about $130 back in your bank account that you can spend on food or medicine or whatever you want, and it will help you have a better life.
If someone is dual eligible, are they still able to take advantage of the annual enrollment plan with Medicare? Does that get tricky?
No, they absolutely can, but that's a great question, Beth, because if you are dually eligible, you actually have an ongoing enrollment period, which means you can enroll in a different plan every month if you want. Now, obviously, we don't want that to happen. That's a lot of chaos for that beneficiary in changing. But Congress decided that Medicaid beneficiaries are a group that should get an extra special enrollment period, and so they get one every month. And so working with those folks can be a little bit easier, actually, because if they're in a plan that doesn't work for them any longer, we can at least get them out the next month.
Okay, perfect. Kimmy, we do need to pause here for another quick break. But the Medicare annual enrollment period is going on. are you missing out on potential cost savings by not switching plans? You won't want to miss this next segment. We'll be right back after these messages. Stick around. Welcome back. Thanks for staying with us. Kimmy Everman with Montana's Office on Aging is still here with us to talk about Medicare. So thanks again, Kimmy. So we talked about the different types of Medicare plans. We've talked about the SHIP program. Let's take a step back and talk about shopping for Medicare. Are there tools or sources people can go to learn more about the different plans and any help they might need?
You know, if a person wants to do it themselves, they can. If they're computer savvy, they just go to Medicare.gov, and there's a thing there called the Plan Finder. And the Plan Finder, you put in all of the information that you have about your drugs and you know where you want to go to pick them up and what plan that you think might be the best for you. And then when you push the button submit, it comes back with the top plans for you based on your individual information that you just put in. If you don't feel you can do that, which is a little bit complicated, then you call a SHIP counselor. She's going to do exactly the same thing for you, he or she. Another thing that people need to watch for is their Medicare and You handbook that's going to come. They probably already got it by now since we're in the middle of the annual enrollment, but that also has all the plans listed for our state in the back. It's a great document in terms of explaining different things and can be very helpful getting you started on that shopping trip that you need to do. But shopping is exactly what you need to do. You don't just want to sign up for the first thing you see, or even worse, not check every year. Because every year you need to check and make sure that plan is going to be good for you.
Okay, good advice. And so if someone is looking through the book or they're out on the website and they're overwhelmed, would you recommend pulling in family? Just go to the SHIP counselor? What's some good ideas there?
Well, I do know that the Plan Finder site has some little tutorial films that you can watch. However, that is usually not enough for me to figure something out. And I'd say, yeah, if you have, it's usually your grandson or granddaughter that knows all about the tech stuff, pull them in and ask them to help you out. The thing about the Plan Finder and using it, or whether it's on your own or with a SHIP counselor, you have to get for sure your medications correct. And so that's important to have on maybe another pair of eyes on that. And yeah, pull in your family. It's always good to have them involved anyway, so that if you can't communicate for some reason, they know what's going on. If that's not an option, friends, of course, are great, especially friends who already have their plan and have been able to do the process themselves. And certainly, last but not least, talk to a SHIP counselor, because they're going to be happy to help you shop through. The plans are different. They have different formularies, which are just their lists of drugs that they carry. They have different premiums. They have different deductibles. In 2019, they can charge up to $415 a year for a deductible. Some do, some don't, some give you half that. It all depends on what you want. And so it's important that the information that goes in is what is reflecting what your needs are. So any of those.
Okay, so you've talked about this a little bit already, but just to reiterate, if somebody already has a plan, why should they think about going in to choose maybe a different plan?
Well, for one thing, maybe a medication that they take on a regular basis was discontinued by the plan that they're on for 2019. Then they wouldn't be able to get it, or they would have to get it at a higher price through their plan. Or perhaps you're going to have some surgery in the very near future. Your doctor has shared with you what kind of meds you need, and they're not on your plan. If you're in the annual enrollment period and you know some of these things, that's why you're going to look every year. The other thing, which is huge, is the price goes up. You know, the price goes up on bread, milk, butter, everything. So it's going to go up on plans. The structure may have changed. Maybe in 2019 they're going to charge that whole $415 deductible. If you just let your plan roll over without looking, you're stuck with that for the next year of 2019 unless you are able to become eligible for a special enrollment period.
Let's talk a little bit more about medications. That's obviously a huge cost for folks, or can be at least. If someone is shopping around to try to get more affordable meds, what's your advice there?
Talk to your doctor, number one, and find out if you can use generic medications, because not everyone can. Some need brand, and that's going to definitely change which plan you go with and how much it's going to cost. You're going to want to, one thing, that if you're a person that's on a very, very expensive medication, and I'm going to use breast cancer as an example, so with some very high cost medications, talk to the company that makes the medication and find out if they have any kind of program that will help you get that medication at a lower price. That is a great resource, and many, many companies make that a part of their charitable giving each year. So great place to start. And again, if they say no, oh well, you just move on. But that's something that you really want to talk to that SHIP counselor about and make sure that you know what you're getting in that plan.
If someone does go in to look into changing plans, is there a restriction they should know about? Can they just jump around to any different plans? Or
yeah, they pretty much can, unless they're a dual eligible. The dual eligibles, we like them to look at a set of plans that are called no premium plans or zero premium plans, because those are the plans that will cover their entire plan without any out-of-pocket extra. There's about every year 5 or 6 of those companies who agree to be those zero premium plans for the people that are on the low income subsidy, and they're usually Medicare, Medicaid folks.
Okay, we're about out of time, Kimmy, but last question, just really quickly, for those folks out there who think it's too overwhelming, I'm just going to stick to the plan that I have, what would you say to that person?
I would say call a SHIP counselor and just talk to them for a minute. If you don't feel like coming in, they'll do it over the phone. If you feel like it's that overwhelming for you, then get somebody else on board to help you out so that you don't end up a year's worth of a plan that's not great for you.
Perfect. Kimmy, thanks so much. Great
Absolutely.
information. Appreciate your time. And thank you for joining us this morning. We hope you enjoyed the show and that you learned enough to make you feel a little more comfortable about navigating Medicare. See you next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.